Next year, there are some Americans who will be paying higher insurance premiums under the Affordable Care Act, otherwise known as Obamacare. The government says costs of mid-level health plans next year will go up an average of 25%.
Sarah Ferris, a staff writer for The Hill, joins us now from Washington. Okay, Sarah, so if you're not insured, there's roughly, I would say, about a $650 fine for young people particularly. What's the biggest concern, especially if you think you're healthy and you really don't want the health care?
Well, for people who are going to be facing this penalty next year, this is going to be something that you are paying to not get any coverage at all. So the Obama administration is trying to make the case next year that if that instead of paying the penalty, you can pay to the premiums to have the insurance, and then you'll actually be getting something for your money.
Sarah, we know that this will most likely not affect about 85% of the people who are signed up on Obamacare. Those are the folks that will be most affected are those who essentially are not receiving subsidies. Explain to our viewers the distinction there, because I think there are a lot of people who are trying to figure out how many people will be hit by this premium. We know that 20 million Americans already now have insurance under the Affordable Care Act, but this is clearly going to hurt some people.
Right. So the vast majority of people, as you said, are not going to be directly impacted by these rising premiums. About 85% of people do get federal assistance. That doesn't necessarily cover all of it, but it does help with much of the premiums. But again, that's 16% of people who are going to be hit by this directly. It could really make a big difference. This could be a couple $100 extra per month that they're seeing next year.
And we've been saying that the average will be 25%, but there are some states where it's going to be a whole lot higher, right?
Right. So if you look at Arizona, that's 116%. Minnesota is above 50%. It tends to be in rural states. So Nebraska is another one. And this is because, in part, because of the shrinking competition among insurance options in those states. But if you look at states like Rhode Island, Indiana, that's a 2% decrease and then another 2% increase. So it really runs the gamut here.
Sarah, whoever ends up in the White House, could they repeal the Affordable Care Act? And what would they need to do? What's Hillary Clinton's plan? Does Donald Trump have a plan?
So Donald Trump has been very active on the campaign trail in the last 24 hours since this data came out. He has gone and said Obamacare is over. We have to repeal this law. We have to replace it with something. He hasn't given too many details about what that would look like. But Republicans are really coming out and taking this attack line that's been essentially handed to them 2 weeks before Election Day about the rising costs under Obamacare. Meanwhile, Hillary Clinton hasn't said that much. She did say in an interview last night that she would make some changes and try and prevent these premiums from going up again. She hasn't given that many specifics yet either, but this is not an issue that's easy for Democrats to talk to this close to Election Day, which just happens to coincide with the beginning of open enrollment for the Obama administration.
And Sarah, Donald Trump has been hitting the campaign trail hard, using sound of President Bill Clinton at one point saying that the Affordable Care Act was the craziest plan. But the question I think a lot of people will have, and this is nonpartisan. In other words, the Republicans have said they want to repeal Obamacare. Hillary Clinton is saying she wants to fix the parts that aren't working. But how would either Democrats or Republican take away the insurance of those 20 million Americans who now do have insurance under the Affordable Care Act?
Well,
in other words, it's repeal, but then replace with what, I guess?
Right. Well, fighting Obamacare has become a really difficult talking point for Republicans, and that's partly why we're not seeing it on the campaign trail much this year. There has been very few Republican candidates who are willing to go out there and campaign on this. John McCain is one of the few. We've seen ads from Kelly Ayotte up in New Hampshire. We've also heard a bit from Roy Blunt in Missouri. But other than that, this has not been an issue because, as you said, it's difficult for Republicans to say they want to repeal this law, which is directly providing coverage to 20 million people. And then on top of that, young people can stay on their parents' plans until age 26. People are having these protections if they had pre-existing conditions. There's some parts of the law that even Republicans say they wouldn't repeal. And so when you try and talk about the greater message and what Republicans want to talk about before Election Day, so far in the campaign trail, it has not been Obamacare, though we're starting to see that change because of the data that came out this week from the Obama administration.
It's a fascinating look. Sarah Ferris from The Hill. Thanks, Sarah.
Thanks for having me.